I was really moved when on social media months ago, I saw a video that was posted from the Ukraine. A cardiac surgeon was taking open heart surgery patients down into a bunker as bombs were going off overhead. And I can only think about how difficult it is in our own healthcare system and in my own practice to look after these patients. I can't even imagine what it'd be like trying to care for these patients during a war. And so I was really moved by the video. So I contacted him through social media and I wasn't sure if he was okay, if he was alive, and he contacted me right away and he told me he was okay and they were doing the best they could. And I asked him if there was something we could do to help. And he said, supplies. We really need medical supplies. Here's some, electrodes that are absolutely critical for cardiovascular care. Something as simple as a bladder catheter. You can't do safe open heart surgery without a bladder catheter. If you don't have these, it's going to be really tricky. We've got other things here. This is called a pneumothorax kit. So if you get air around the lungs after surgery, you need one of these kits to relieve the pressure or someone could lose their life. So I can't imagine trying to provide the intensive care you need for open heart surgery to make it safe without the right kinds of equipment. So, even something as simple as a gown, a sterile gown, if you run out of those, what are you going to do? And people there are very creative. They found all kinds of ways to try to, get things done. And that's part of what inspires at least me and others to try to support them because they're doing everything they can. And, these resources will really help, I think. Their needs are going to continue, and I'm hopeful that, from this, the next step is we can reach out to other departments. We're cardiovascular, and obviously we're providing support to a cardiovascular institute, but I can only imagine that every other type of institute or program in the Ukraine also needs help. And then maybe Alberta Health Services and the University of Calgary can look at other areas. So I'm hoping this will be a spark to raise some awareness of what you can do, right? Even at a small grassroots level to try to make a difference.